What is gestational diabetes? Gestational diabetes is a condition in which blood sugar levels become high during pregnancy. Nearly 5 to 8 million Indian women are getting affected annually. Gestational diabetes goes away after women gives birth, but it can affect baby's health and it can raises the risk of getting type 2 diabetes later in life. Hence, it is very important to take steps so that pregnant women and their babies stay healthy. Women with gestational diabetic usually don't have symptoms. Hence, it is important to carry out routine blood checks to confirm the onset of gestational diabetes. Some pregnant women may feel thirstier than usual, hungrier and eat more than usual, urinate more than usual. These women should consult their gynecologist immediately. What is the root cause of gestational diabetes? When we eat, our pancreas releases insulin, a hormone that helps move a glucose from our blood to cells, which use it for energy. But during pregnancy, the placenta of pregnant women makes hormones that cause glucose to build up in their blood. Usually, pancreas can send out enough insulin to handle it. But if pregnant women's body can't make enough insulin or stop using insulin as it should, blood sugar levels rises and that leads to gestational diabetes. So, who is at higher risk for gestational diabetes during pregnancy? If you were overweight or obese, or if you had PCOS or irregular periods before pregnancy, then you have a higher risk for gestational diabetes. Similarly, if you have a family history of diabetes or PCOD, then the risk of gestational diabetes is high. If you had gestational diabetes during previous pregnancy or history of miscarriage, also the risk is higher. How does gestational diabetes affect pregnant women and baby? Gestational diabetes that's not carefully managed can lead to high blood sugar levels. High blood sugar levels can cause many problems for pregnant women and baby. First, let us understand how gestational diabetes affect the health of the baby. 1. Baby can grow bigger and very large babies are likely to have delivery-related complications and may need C-section birth. 2. Higher possibility of preterm delivery and the associated health risk like breathing difficulties for the baby. 3. Babies have higher risk of developing obesity and type 2 diabetes as they grow. There are complications arising out of gestational diabetes which will affect pregnant women also. First risk is high blood pressure and preeclampsia. Gestational diabetes raises risk of high blood pressure for pregnant women as well as preeclampsia, a serious complication of pregnancy that causes high blood pressure and other symptoms that can threaten both life of mother and baby. If pregnant women have gestational diabetic, then it is more likely to get it again during a future pregnancy. They are also have a higher risk of developing type 2 diabetes as they get older. So, it is very important to control blood sugar and to maintain at optimum levels all through the pregnancy. With proper guidance, if you can make diet and lifestyle changes, the gestational diabetes can be managed effectively without causing any harm to the mother and the baby. Even though every person is unique and may need a proper professional guidance, some key guidelines with respect to diet will helpful to all pregnant women with the risk of gestational diabetes. Number 1. Eat a healthy low sugar diet. 2. Reduce consumption of high carbohydrates food in general like white rice, rava, wheat and root vegetables like potato. Completely avoid food made of refined flours and sugar including cookies, candies, chocolate, ice cream, etc. Fast food, bakery items, fried food, carbonated drinks should be avoided. 3. Add millets, brown rice or red rice as a replacement for white rice. Consume more fiber-rich above-ground vegetables and greens. Take dal, sprouts, lentil, paneer, nuts, seeds in your food in moderate quantities. Consume whole fruits like apple, papaya, muskmelon, watermelon, berries, etc. If you take a non-veg, include lean meat like chicken and fish in your diet. Have 3 meats along with 2 or 3 snacks about at the same time every day. Most of the carbs should be complex, high fiber with low GI. You shall add 20 to 35 grams of fiber daily. Pregnant women with gestational diabetes should stay active to control blood sugar levels. After getting concurrence from their gynecologist, pregnant women can do 30 minutes of moderate activities like walking, slow running, cycling, swimming every day. It is also important for pregnant women with gestational diabetes to prevent excessive weight gain during pregnancy. It is better if they lose some weight also during pregnancy. Similarly, getting proper sleep and managing stress are very helpful to manage sugar levels. At 6D Healthcare, we provide a holistic diet and lifestyle management program with daily monitoring and have helped hundreds of pregnant women to keep control of their weight and manage gestational diabetes to ensure safe pregnancy. Please do contact us, and our office address and mobile number are given in description. Thank you.